as physicians, we're not very adept listeners. And early on, I learned that if I really wanted to understand someone, I needed to take myself out of it and just hear what they had to say. Pretty typically, I'll listen, and then I'll try to say to the patient, "This is what I heard you say." That starts the dialogue with them about what their concerns are in a way that doesn't make them feel ashamed and vulnerable. So that's the first thing I do. And then I can usually get a bit of a flavor of how much they love themselves. If they love themselves a lot, they'll basically tell me what's wrong, and they will realize they're not being judged by me, and they'll guide me to an appropriate decision for them about a surgical solution or a non-surgical solution. So that even though they might need a surgical solution, I might recommend a non-surgical solution for them. And that's what really is the dividing line between surgery and non-surgery. How much do they love themselves? If they love themselves a lot, they have surgery. If they don't love themselves, then they usually don't have surgery. Well, I think the face is the area in which most people's vulnerabilities really show up, because they feel like they're altering their looks, and that seems very risky. And that, like, there's a lot of social stigma around changing your face, much more so than changing your breast, which you can hide, changing your body, which you might get lauded for because fitness and wellness is like considered good in society or empowering in society. So I think that there's far less judging that goes on about your breast and your body. But face is really the thing where there's a lot of judgment being levied. And it's usually the patient judging themselves, of course. Shaming of the body is a huge thing for women, and women just, no matter how good looking they are, they're always looking at themselves like they're not good looking. I think that there are clearly people in whom a surgical solution is a better solution, but because they don't show up loving themselves, what ends up happening is they almost always select themselves for a non-surgical solution. So I think that for me in my practice, what I've seen is that the more confident you are, the more you love yourself, the more willing you are to let go and put yourself in my hands and let me make the decision about what the right thing is for you to achieve the goals that you have set for yourself.